Tiny Life. Today I'm going to tell you about my first experience on antidepressants. So if you don't know, I suffer with PMDD, and this is premenstrual dysphoric disorder. I think that's how you say it. And this basically is PMS but times 100, so it's just very exaggerated PMS symptoms, which can cause like depression, bad mood swings. Every positive emotion turns to negative, so excitable, angry, happy, sad, paranoia, like some of the most negative things. Happy delusions become the darkest delusions. And it can sometimes feel like a cloud is coming over, and it starts this is how I describe it, because it feels like this. It feels like a normal world, but darker. And actually, a few years ago, I posted like a meme of Stranger Things, and it's 11 standing there, and then the clouds are like dark and red and coming over, and I saw that and thought, I feel like that right now. Like the world is just darker. It just feels like a cloud over me, and I am finally getting something to help with that. This took me a while, but yeah, I think there's a common misconception with depression and antidepressants. So I was a little bit scared to go on antidepressants because you're told that you've got to take them all the time, and because I'm a little bit of a control freak, I don't like something to be in control of me. Like, I don't feel like I've got to take that med to survive, or I don't like to feel like I'm going to be dependent on something. Very strange like that. I like to be independent in everything. So medication like that scared me a bit, because I was thinking I don't want to become dependent on it. But at the same time, each time I have a period, my PMDD gets worse. So I'm okay when I'm on contraception, but as soon as I come off that, and I'm trying to get a diagnosis with endometriosis, so when I come off that, each time I have a period, my PMDD gets worse, so I needed something this time. Now I know more about it and stuff. Anyway, I'll explain. So a common misconception about antidepressants is that you have to continue taking them and it takes weeks for them to work. This is true for things like OCD, PTSD, what's the other one? Manic depressive disorder. Yeah, so those things, because it's rewiring your brain, you have to take it constantly for it to work. And then if you come off them, you have to come off them slowly. Whereas for PMDD, you only have to take them around ovulation, or when you feel the symptoms coming in, up until you normally feel better. So normally around the first day of your period, you can stop taking them without gradually coming off. So when I found out that, I thought, okay, I think I could deal with that. Anyway, I had my first one yesterday, and I was so high. I was reading online that, it takes a while to kick in and whatever, and it's very rare to feel better straight away. Wow, yesterday was wild for me. My pupils were dilated. It was a little bit of an exaggeration that I hadn't blinked for 30 minutes, but it was at least 10. I hadn't blinked for 10 minutes and I had to keep reminding myself to blink. My walls are white in my hallway. It looked like they had lights behind them. They were like bright white, just shining at me. I was thinking, is it time for me to walk into the light? I just felt so strange when I was sitting or lying down. I didn't feel as bad, I felt normal. And then as soon as I got up to do something or I started talking, I felt like everything was slow. It's very, very strange feeling that I got. I didn't sleep, so I took it at 7:30 and I was still wired at 4 o'clock this morning. I managed to sleep for a little bit and then I woke up about 8:30 and actually was fine. I feel great today. And I've had a few thoughts creep in, but I've been able to pull them back. I've not dwelled on them or overthought or beat myself up about it. I've been okay. So I don't think I need them as much. So I think I'm going to try a lower dose. And the doctor did say that I don't need to take them. I can take them one day on, one day off, if I feel like that's better. And honestly, if I feel like this after one, I probably won't take them again until I have a dip. Because if it works like that, I'll just do that. And I don't mind having one high day where I can't really do a lot to feel better the rest of the month. I'm okay with that. If it works like that, I don't know. I could just be still feeling the effects of yesterday. I don't know. I've never had them before. This was my first time. If anyone does have advice on how it worked for them, but I was speaking to a nurse yesterday and she said she also felt the black cloud, but she said she took the ones that I'm on and she was absolutely fine on them. They just made her feel hungry, which I did feel hungry as well. Ravenous, like I couldn't fill myself up. But then when I was eating, I felt sick. Really mad day yesterday. Oh my god. I had an appointment and I don't know how I got through the appointment. It's a good job I had a list of all my symptoms because I wouldn't have been able to reel them off, and I still didn't say all of my symptoms because when I got back I was like, oh, I didn't mention that and I didn't mention that, because I said, after I'd reeled some of them off and I said, when I went on the pill and it got rid of it all and I can't believe it, and he said neither can I, to be honest. And then that set in doubt with me, because then I was doubting myself, do they believe what I'm saying now since he made that comment? Even though he was probably thinking I've never heard of all this before, but then again I also think that women don't always tell everything, and sometimes we forget in appointments all the problems that we've got, especially yesterday because I was out of it anyway. But then I was also thinking, because I'm out of it, is he taking me seriously? And then this was creating doubts in my head about how this appointment was going, so then I kind of didn't say all that I wanted to say, which is ridiculous now. I'm saying it here on camera. I should just record myself and take me in and say, look, this is what I want to say. Because as soon as I'm there, they only have to say one little thing and it sets my doubt. It's so annoying. It's such an annoying trait of mine that I need to sort. So I have got therapy Friday as well, because the nurse that the doctor that the doctor that prescribed, don't forget to like and subscribe. The doctor that, just get on with it. The doctor that prescribed the meds said that I should still see a therapist because they can help me manage the thoughts and feelings around my PMDD. Because also, if I had have seen the doctors when I'm not in this stage of my cycle, so confident, I can tell them what I'm thinking, what I'm feeling. If they make comments like that, I tell them, like, no. I'm so confident during those 2 weeks, and it just flips, like, it's so annoying. And I get so frustrated with myself, and it's really difficult when people say, like, what have you got to be depressed about? Nothing, Pab, absolutely nothing. But try telling my head that in those weeks, like, it's so frustrating. I'm also, like, if you can hear hair sounds, I'm playing with Benny and he's got a wig on, because I think I'm nervous talking about this. And I think that's another thing, because I'm smiley and bubbly, and if people don't believe me that I have all this going on, because I can turn up still and I can still do things, but it's masked half the time, and I think that also exhausts me, because acting every day during those 2 weeks is exhausting. And it's easier for me to talk to the camera like this than it is to talk to people. In real life. So, that's me being a little bit more open and honest about me, because I rarely am. I rarely talk about how I'm feeling and things. I just get on with it. And I'm being better about it now. But I think I often don't talk about it as well, like in person, because I always think like other people have problems as well. So I don't want to burden them with my stuff, because what do I have to be depressed about, And when they've got their shit going on, especially when nothing sets it off, like there's literally nothing that sets it off. Anyway, this was meant to be a light-hearted video of me telling you about my eye, and then all this emotion. Maybe I'm not okay yet. I'm not out of the woods yet. Maybe I'll take another one tomorrow. I've got a lower dose, and I'll see how I get on. But if I've got to deal with the eyes all the time, I don't think I can deal with that, because the embarrassment, that's another thing. The embarrassment of not being able to explain myself properly because I'm high, or not being able to do things for myself because I'm high, not being able to do things for other people because I'm high, that bothers me. Then I feel guilt. But anyway, all of this only happens, all of these thoughts and feelings and posting it. Oh god, it's so weird. But yeah, if you're scared to take, if you have PMDD and you're a little bit dubious about taking antidepressants, I would say try B7 first. The doctor did say to me, I mean, depending on what other medication and stuff that you're on, like, I'm not a doctor, but if you don't take anything really and you do feel like your moods are affected around this time, then B7 may be able to help. I feel like, I mean, it possibly could, but I feel like my darkness is too deep for a vitamin to help, and my vitamins were fine when they tested me. They all came back really good. So I have it as well. I did start taking B7. I have it as well, but I feel like I need something to just take the edge off some days. I can deal with a bad thought here and there, but when it's just constant, absolutely everything I do, I needed something more. Even if it was only for a day. The first day of the luteal phase, I'll have to keep you updated with how it goes and how I feel. Maybe if you're interested, you might see my full mental breakdown, who knows. But I wrote something on Patreon yesterday, but I wanted to do a little video about it. Also, me and Nick are going to do an ASMR video about it, so I'm going to be the patient. I'm going to tell Nick what questions to ask, and where she's going to like diagnose me and whatever. I think that'll be a very fun video and also raise awareness. We won't make it like this is what you have to do, of course, but it will be educational to what can help PMDD, and how it can feel. I can describe my symptoms in the video and things like that in more depth than what I'm doing here, and less serious, well, and just more fun way, because Nick has more females on her channel, so I think it might be more beneficial on her channel, just so it reaches more women that maybe having these problems. I do have women on my channel as well, and hopefully this reaches them, but it's also educational for the men, to realise why sometimes we can't control our mood swings. And so yeah, we're gonna do that, which I think will be fun. Any questions, obviously put them down in the comments. I'll help where I can. My advice is, if you're gonna see a doctor about this, take all the research that you have, research, ask questions that you would ask the doctor online, like ask Google, because if Google says something, and you think, oh, that might benefit me, take that to the doctor. You kind of have to tell the doctor what you want now. They don't advise. So the thing is, you're going to them looking for help on what to do, but they don't tell you what to do. You have to tell them what you want them to do. This is in my experience. I feel like every time that I've gone to them and told them my problem, they do blood tests and then they leave me to it. If my bloods are fine, you have to go to your appointment, tell them your symptoms, and tell them what you'd like. So if they give you a blood test, fair enough, but tell them, I want to try this, or could I try that? questions, and then they will direct you. So make sure you research before you go. If you get a little nervous like I do, and then like you freeze up in the moment when they're asking you questions, write it down on notes or take paper. You know, if you want to write it down on paper, write down in a Word document, print it off, give it to them. If you feel uncomfortable talking, or if something they say might throw you off so you don't go any further with the conversation, make sure you have it near you so you can say no, like, this is what I want, and be direct. You have to be. I'm saying this and I wasn't direct enough yesterday. I should have said more, but I still got what I wanted. I don't know how to say it, but I'm getting a laparoscopy. Laparoscopy. Yeah. Google it. Laparoscopy. Just put laparoscopy and then the words in between will come up. Anyway, keyhole surgery, to see if it is endometriosis. So I still got what I want. So you need to be direct. Tell them what you want. Okay. And if you were like me, your meds sometimes affect you, your hormones sometimes affect you. Have it on your phone, so you've got it there if worse comes to worst. And you know what? If you finish your appointment and think, oh, I should have said this, I should have said that, you can always just write a note to the doctor. Sure, I don't know, but try. You know, say I missed this off. Can you put them on my symptoms? I've never done that. I don't know if you can, if you're supposed to. I don't know. But to be honest, the stage I'm at, the next time they see me, I can say my symptoms again anyway, because it's going to be like 9 months and you have to see them again before. So don't think it's, you know, the be all and end all that you didn't say that symptom, because when they see you again, you've got a chance to mention it again. Anyway, that was just a ramble, that bit. I don't know why I even included that. I guess just a reassurance, because sometimes I need to hear those things. That it's not the end of the world. That's the anxiety around this time makes everything the end of the world. Yeah. I feel proud of myself that I'm being open about this and honest about it, because there was a time I wouldn't. I'd just deal with things myself. Because I'm scared that people just, yeah. You know what, also, I'm scared that, I mean, because people don't take me seriously as is, because I'm small and smiley, and people don't really take me seriously as it is. So now I'm taking antidepressants for my mood swings. If I have like a genuine problem, I'm scared that people won't take me seriously. Like if I've got a genuine gripe about something and I'm like, no, that made me upset, or I don't appreciate the way you spoke to me, something like that. I'm scared that they won't take me seriously. They'll just think, oh, it's hormones. Do you know what I mean? So yeah, I was scared of that, to be honest. But I'm not scared of that when I'm in my best 2 weeks. If I've got a problem, I tell you, and it's not a problem. But then in the 2 weeks, what I've said previous might start affecting me. Like, I'll start thinking, why did I say that? Why did I mention it? Why do I care if they were moody with me, you know? Why are you making them feel uncomfortable for being moody with you? If they want to be moody with you, they can be. You know, that it's silly stuff that is constant. So yeah, that's why I'm taking antidepressants. And yesterday I was high as a kite, and today, after no sleep, I still feel good. So, ish. hopefully this can help anyone else that's like been going through the same and is also a bit worried about it. And we'll be doing an ASMR video about it, so hopefully that can shed more light as well and make it more comfortable in the medical setting. Because if you see us role playing out, it's going to be easier for you to role play that isn't in that environment, because it can be quite nerve-wracking anyway. So I think like the video can help with confidence. Anyway, thank you so much for listening, and if you have any questions, put them in the comment section, and I'll see you soon.